you guys are having a wonderful day. Today I have a very special guest, Allison Russell. Hi, I'm Penultimate name was Allison Russell, and we're gonna be talking about Hoffman-1 syndrome. So if you want to hear about that, stay tuned. If you like this video, hit the thumbs up button below the video, subscribe if you're new, and please turn on subtitles if you need them. So do you want to introduce yourself?
Yes, thanks, Anna. Thanks so much for having me. You did pronounce my name correctly. It's Allison Roffers, and it's kind of a difficult name to say. I am located in Springfield, Missouri, and I have a child with a severe disability called FOXG1 syndrome.
Nice. And you might know who Pam is if you've been here for a while now. Ask me how I found her because I go to the Missouri State Public Office every year. So I'm excited to talk to you about this topic, and I hope you might enjoy it as well. So my first question is, I know your son has Hoffman-1 syndrome. Do you want to explain what that is for people who might not know what it is and how he might be affected by it?
Yes. So FOXG1 syndrome is named after the FOXG1 gene. So all of us, every person has the FOXG1 gene. And when it's not formed correctly, they potentially could be diagnosed with a genetic disorder called FOXG1 syndrome. And what that means is that the FOXG1 gene in the brain did not form correctly, which is what my son's diagnosis is. So as you can imagine, if it's a gene in the brain that's not formed correctly, it impacts virtually everything. He is severely cognitively and motor impaired.
Yeah, I can imagine how that because I actually have a friend who has a very, very similar disability to it. And it's like all the whole thing is impaired by it. So, but that doesn't mean if you're someone walking that you may not know, that doesn't mean people like them don't want to have a normal life too.
Right. Yeah, for sure.
Because I know my friend who used a talker and a wheelchair, and he has a very bright personality for it, and people don't even listen, but we have what appear to even be heard, which I think is really wrong. You need to let everybody appear to be heard.
Yeah, it might, people have to use different ways to communicate, and they might have, some, like for my son, it just takes a little bit longer for him to communicate sometimes his wants and needs, but it's still there. You just have to kind of be patient.
Right. My question is, can you explain your home diagnosis, Manny?
Yes. So Lane was, he's my second child. And so pregnancy and delivery for Lane was very normal. We didn't know anything was going to be brought into our life, any difficulties or diagnoses were going to be brought with Lane. We had a normal delivery. And then as soon as Lane was born, I could hear kind of a strange squeaky sound every time he took a breath in the delivery room, and his color was a little off. He was a little blue, and just from having a child previously, I knew that was different than how I had experienced it prior. And I immediately said something to my doctor, and she said, "Oh, you'll know when to worry. You'll know when to worry. It's fine. He's just working stuff out." She was very sweet. And then the nurse set Lane on my chest for skin to skin time, and his little body went completely limp. So they took him immediately away and started chest compressions to revive him, and then hit the emergency button to get the neonatal doctors to come into the delivery room instantly. And that really was the beginning of a long a long journey that we've been on in just the short 5 years of his life. um, that day led to life as we know it now, with multiple doctor's appointments, diagnoses, specialists, surgeries. We've been, far distances to experts in various hospitals to try to get the best help and care that we can for him. He has over a dozen diagnoses now, but the two primary ones I'd say are the bilateral vocal cord paralysis, which means his vocal cords are paralyzed, which was what was causing the squeaky noise whenever he was trying to breathe. He couldn't get the air quite through there, so it was making what they call a stridor sound. And then FOXG1 syndrome is probably the all-encompassing diagnosis that has led to the other secondary diagnoses. So yeah, it's been quite the journey with Lane.
Yeah,
He also had, sorry, he also had a for the first 2 years of life, where we had surgeries in Cincinnati, at Cincinnati Children's. They had specialists there to widen his airway, which let him become trach free. So he's been trach free for 2 years now, thanks to that surgery. But
amazing, yeah. I interested with Terrible Pony too. I wasn't diagnosed. Well, I was adopted, and so I wasn't diagnosed with Terrible Pony until the age of 2, and it's amazing how much things can change and what medical advice we have out there to make everybody my state of and because for me, my right side, which is my weakest side, my was paralyzed a little bit, and so I had a back surgery that allows me to move now on my right side. So it's amazing that you said your son is 20, which must be amazing for him now.
yes, it is so much better to not have the trach and worry about all the things that come with that for him. I'm glad you said that about your diagnosis, that you weren't diagnosed until 2,
Yeah.
because that triggered my memory of he wasn't diagnosed with FOXG1 syndrome until he was 18 months. So he had lots of genetic testing done to get to that diagnosis.
Yeah. What is the biggest challenge you see for your son as parent?
Well, the biggest challenge, I would say, hopefully I'm speaking for most parents when I say that our biggest wish for any of our children is that they are healthy and happy. And for Lane, that is still our wish is the same for him as it is for our other 2 children. It's just really challenging to know that we've achieved that.
Right.
Since he's nonverbal. He can't really tell us if he's super happy. He can show it with his emotions, of course, but I mean, we just always are wondering what could we do better or more so that he would like and that he would enjoy and that would make him happy. And how do we for sure know that he's happy? So I think that's just been a big challenge for us, is just wondering if we're doing what he actually wants us to be doing, or if we could be doing something better and not knowing.
Right. I feel like the sound for most parents that I know that I have talked to throughout my journey here on YouTube and social media. I really connected with about the parents with variety of disability, and then any advice to knowing when my child is happy, or what should I be aware of for when they're older? And I think that all boils down to a more inclusive society and a more disability accepting society. Because without it, you never know what's going on, especially when your child is nonverbal.
Yes, that's true.
Yeah. Because that's why I started my advocacy work, is because I noticed in a high school, for example, there are a lot of things that look over when you have a disability and could not advocate for your basic IP or basic life things. Like if you wanted to be not bundled in with disabled people, and parents are not being aware of that because you can't tell if they're happy and how happy. It's impossible to tell. You can't tell what's going on in their day-to-day life because they're non-verbal, and who knows if you're being told the truth. That's the other
Right.
thing. Some professionals that work with them.
Mhm. Yeah, I think that's very true. It's the advocacy piece is so important, and just, challenging other people to become more inclusive and think through every situation with multiple lenses, not just the lens that they're used to looking through. So,
Right. In high school, I heard a lot from the
I'm sure.
SSD department, and I don't think the professional, knew that I understood everything they were saying, and I'm like, I misheard you say that.
Uh-huh.
And then when I would know and tell my parents or tell my sister animal, they'd be like, oh, you heard that? And I'd be like, yeah.
Oops.
Yeah.
Yeah.
Yeah. I can completely, I'm with you there. You never know when you drop your son off at a place or with a family or whatever it may be. It's impossible to know if they're being cared for or happy or given everything they need.
Yeah, that's scary. It's a scary, vulnerable place for parents of kids with special needs for sure. So,
Right. Um, I know you are. Whoop, my iPad fell down. Hold on. One sec. Whoop. Hold on. Now we. Okay. I know you are also a school customer. What has being a special needs mom taught you about being a customer?
yes, I am. My work history is school counseling and in the educational field, and being a special needs mom has certainly, I think any new experiences brings new perspectives, and so being a special needs mom has certainly provided a whole new world of perspectives. I worked in school settings, and I worked with students of multiple disabilities and multiple backgrounds and various needs, but I certainly have a much greater understanding of that world, and the world that specifically the parents are living in, and the struggles that they are experiencing. So I think that it 100% has made me a better educational advocate, and hopefully a better leader for school counselors too.
Yeah, I hear and I might be wrong here, but I hear my educational system needs to have more and education.
Yeah.
Because I recently did a video on the channel with an older teacher, and he was saying how messed up the system really is for special needs individuals. And
Yeah.
I not only for educator or hospital or administration, but also for students. I am a big advocate. I think disability education needs to be taught in school as a requirement.
Yes. Yeah. So often with diversity, especially, as of late, diversity trainings and inclusivity does not specifically talk about students with physical or cognitive disabilities. And it's often kind of late left out of those conversations and those lessons, where that is it needs to happen. It needs to be more of a conscientious effort to make sure that there's more inclusivity in the schools, and that every student feels like they are welcome and that they have the same chances and opportunities that other kids are given in that
Right.
setting, for sure.
And what this is not on but what I'm wondering, what are some of your tips on how to make that happen?
Well, speaking from the school counselor perspective, we, as a school counselor leader, I strategically place lessons in our curriculum at a young age for students that show how to be a good friend to all, and how to be not to exclude others for differences. And we certainly have videos and picture books that include images of students of all types. So students in wheelchairs, playing with students who are not in wheelchairs, talking through how you can be helpful to others, or thinking about how others, who can't see, how can they get from place to place and school? How do they know where to go? Just trying to bring in other thoughts and build empathy and understanding with students among other students. So that's one way. I know that it's not as comprehensive as I would like for it to be, but that is one way for school counseling. I'm hoping that schools from the district level just continue to get better about trainings and building understanding for staff members on how they can take lessons, not just with the school counselor time, but in their classrooms, to build social emotional learning and understanding of multiple people's perspectives. So I think there's certainly room for growth, but I think it needs to come school wide and not just from one professional, in the building. So.
Because I haven't heard, and my 12 years of schooling, I never got any education about disability. It was all from my personal wondering that I would look up on the internet, find disability vloggers on YouTube, my parents. So I think it's amazing that you are taking the initiative to make at least somewhat a message on disability awareness, because I never heard anyone doing that in the school system. And I've been in 2 different school districts, and both of them have not provided that.
Yeah. Yeah. It's certainly, I mean, and I'm not saying we do it perfectly either. I
Right.
think that we need to do more of it. But it is, it is something that I think most people may not think about, unless they have a connection to somebody who is impacted.
Right.
So yeah, I think it definitely needs some more attention in our schools.
I couldn't agree more. Um, what is your better piece of advice for special needs parents?
My biggest piece of advice for special needs parents is to take time to take care of themselves. Um, being a special needs parent, um, being a parent in general, but being a special needs parent specifically is is hard work. I mean, it's heartbreaking to not be able to just make things easy for someone that you love, um, and it can get very emotionally taxing. So I think it's important for special needs parents to band together with other special needs parents, kind of like you were saying that you did, Anna. You did research on your own to try to figure out
Mm.
more information. And I would encourage parents to do the same thing. Don't isolate yourself. Talk to other parents who are walking similar paths. Network and advocate whenever you have energy, but also make sure that you have time and you're making sure you're advocating for yourself to have time to take care of you so that you can be the best parent you can be to those kids.
Right. And I, for any parent watching this, I would also look into any therapy that your child or adult is doing. Sometimes the therapy actually have parent support with them or day.
Mm.
I know I ride horses. I am an adaptive equestrian, and I also volunteer at my horse on. And this past weekend, they had a parent retreat, a Stephanie
Awesome.
parent retreat. So look into
That's cool.
that. Yeah, yeah.
Yeah.
Um, okay, and my last question is, as, as parent, what do you hope the world know about your son and others like him?
I hope as a parent to Lane and as somebody with severe disabilities, I hope that people who come across Lane or us or our story or who watch this, I hope that they start to do their part to really think about how they can advocate for inclusivity.
Mm.
Look at just even looking at your surroundings, like your daily surroundings, your school or your work environment, and what can be done to better support people with special needs, people with disabilities. So you might think it's something small, like helping to advocate putting in uh, handicap accessible doorways or a ramp that's not, access or handicap parking. Something that might seem small on a great big scale of the world, but it can make all the difference for one person or for a family. So I would say what I want people to know is that you can make a difference. The power of one can make a difference in someone's life, just by thinking about them and helping them feel seen.
Right, I definitely agree because there are plenty of people who I run into in my daily life who are like, "Oh, I will pray for you," or "Oh, I'm so sorry you have that disability," or "Oh," and I'm like, "That's very nice of you, but I believe that my life is so much more than a pity party, you know.
Yeah.
And I'm if they would channel that enemy into actually doing their research and figuring out how they can help me reward more and that would be more useful for me than coming up to me or a family I'm with or my parents and saying, oh, I'll pray for you or oh, I'm so sorry you have to deal with it. Because not everybody feels sorry about their disability. I
Right.
certainly don't.
Right. Or you're so strong.
Yeah. Any
Yeah.
comment like that, I'm like, thank you, but you know, I live my life to my best of my ability, and I'm pretty happy. Like, I horseback ride. I go out. I was telling you earlier. I come down to Sincere and visit my best friend. You know, and I'm like, when people say that, I'm pop in my class, and I'm like, I'm not. I'm gonna say thank you, even though I wouldn't say more. Yeah.
Yeah.
So use that enemy to actually figure out how you can make the world a better place. Yeah.
Thank
Yeah. So thank you guys for watching this video. Thank you, Allison, for being here. It was amazing. And if you guys want to hear more stories like this, subscribe, leave a comment down below if you have any questions for Allison. I could send them on over to her. And I look